guys, welcome to the first video of my 5-day mini course, and we're going to chat about communicating with those nursing buds, those people elbow to elbow with you. I'm talking your nursing colleagues, but also your CNAs, certified nursing assistants, patient care technicians, whomever the other support staff might be that you're working elbow to elbow with to provide that direct patient care. All right, I'm going to talk about 5 things. Number 1 is going to be rapport. Number 2 is starting off right. 3, giving a heads up when things change. 4, reflect when you don't understand. And 5, disengage and gossip. So I'm going to dive deeper into those and let's get started. So number 1 is building rapport. I want you to think about your nursing unit like an athletic team. All right, let's say you just started playing basketball for this team and you just got signed on. Well, at the beginning of a season, a lot of teams will go do team building exercises. They'll go on a retreat. They'll go do these things where they build trust with one another. And I want you to think about your unit like that. You have got to build trust with these people. And it's challenging as a new nurse to do that because you're new and you're not like this person that they can all of a sudden rely on or say, here, can you watch my patients? You know what I mean? It's hard to feel like you bring value at that point, but you do. You're just in learning mode. And the way that you can really demonstrate, not demonstrate, but build trust is being reliable with these people, showing that you care about them. So not just about what they can offer you at work and how they can help you, but hey, how are you? Like, how was your weekend? What do you like to do? Like, just kind of getting to know people and showing that you're interested in getting to know them, and it's not just about what they can provide you at work. And also through building rapport, just hey, showing that you're a hard worker, showing that you're going to ask the right questions, that you care about the right thing to do for the patient, that you want to help people out. And as soon as you're capable of doing that, that you're going to jump in and take the initiative to do that. And that is an aspect of building rapport. All right, so that's number 1. Number 2, start off right. I want you to start every shift off right. So don't just get rapport, put your head down and go. Get rapport, but then when you find out information about your patients and you get your mind a little bit around your day to the best of your ability at this point, talk about that with the nurse that you're kind of in a lot of people do pods, or like, hey, my patients' rooms are near your patients, and so if you need help, ask me, kind of thing. So that 1 or 2 other nurses that you know you're going to be around a lot during the day. I like to say, hey, what's your patient load look like? Like, do you got anyone you're worried about? Are you going to be traveling off the unit? Do you got a bunch of discharges? Let me know if I can help you here. Again, I know you're not going to be at the point where you're going to be ready to jump in and help people, but it's really helpful to know what your team member's day looks like, what your CNA that's assigned to you, if you have one, what their day is going to look like. Hey, maybe they've got 4 high fall risk patients that they're taking care of, and 2 in restraints and 5 in isolation, right? It's helpful to know those things, to be considerate of their time. And so when you're starting off that day and you're wanting to start off right and you're checking in, hey, how are your patients looking? And then when they tell you how theirs are, then you respond and tell them how yours are. So you're not just like, hey, so I just want you to know that this patient is going to be blah, 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 blah. You're like, hey, tell me about yours. All right, cool. Let me tell you, like, okay, I got this patient who, he's a high fall risk. So if anyone sees his call light, I'll get it. But if you could get in there, if I'm not readily available, just because I don't want him to fall. But I'll take him to the bathroom, I'll do whatever, but, you know, like, when he hits the call bell, he's got to go, kind of thing. Or, hey, this patient doesn't speak English. Or this patient is deaf. Had that. This patient is blind. You know, those kinds of things. Or this patient has a restraining order against this person who shouldn't be on the unit. You know, that kind of stuff. It's nice to just kind of let people know so everybody can kind of help each other out. Because it's hard to support each other when you don't know what each other's doing, right? So at the beginning of the day too, it's helpful, especially with your CNAs, to coordinate your day. Hey, I know patients 1, 2, and 3 need baths today. Hey, I'm going to try and coordinate my time to come in with you to do a bath, maybe around 9 or 10 o'clock, and then I can help you with the bath, and then I'll do my assessment at that time. Like something like that, that you're showing you're going to help out your CNA. They're going to kind of help you out so you can get a better assessment so you can see them better. And they're going to get that task done faster for them. So those kinds of things are really helpful to coordinate at the beginning of the day. The next thing, number 3, give a heads up when things change. All right, there's a couple things I want to talk about within this. If you know, hey, I'm gonna do a stat CT scan on this patient, all of a sudden I've got to go off the unit with them, or they've got an MRI and I have to go with them, it's gonna take 2 hours. Or if your patient's gonna have a procedure and you're gonna be in the room for a while, communicate that stuff with the other nurses around you, with your CNAs. Remember, this is a team thing, okay? So you can't just put your head down, go in your room and do your thing. That is not helpful to other people because y'all need to rely on each other. So tell people about that stuff before it happens. Like, I can't tell you how frustrating it was if I was working, critical care and I got my other, person that I'm working with, and I'm like, okay, they haven't told me they got anything going on, so CT just called and they want to scan my patient. So I'm like, okay, that sounds good. And then I go to tell my other person and they're like, all right, I'm leaving. I'm taking my patient to an MRI. I'll be gone for 2 hours. Like that kind of stuff. You really want to make sure that you're communicating your plan of the day when you're going to be tied up with other people that you rely on. Common courtesy, and it's really helpful and makes everybody's time more efficient, facilitates things. It's wonderful if you can do that. Another thing is, if your level of urgency changes, make sure you're communicating that. Nurses have wonderful poker faces, which is great for patients, so they know that, the nurse is going to be calm, cool, collected, even if things don't look so hot. Not so great for colleague to colleague, because if your poker face and your ability to stay cool is so good, I can't tell you need help, that's a problem. That means that you need to tell me when you need help, okay? So if you start drowning, you need to reach out to other people and say, hey, I need some help with this. Hey, whenever you get a second, if you can help me do a couple things, I am hours behind and I'm drowning. Usually if you say I'm drowning, people will say, oh, okay, let me help you. So when your level of urgency changes, communicate that. Don't just expect people to pick up on it and be frustrated when they don't. I think we like to pretend that we're good at noticing that kind of stuff, but we're all kind of not. We're in our own world and we have to try to be aware of other people and their needs a lot of times because we're so focused on getting our stuff done. So communicate when your level of urgency changes. So also when you're delegating tasks, like to a CNA, that's really important. Don't just say, hey, go get a set of vitals. Say, hey, can you get a set of vitals on this patient? I gotta call the physician's stats. So if you could get those as soon as possible so I can let the physician know, because I'm looking up information about their labs from this morning. Things like that really expedite. Don't just say, hey, can you get a set of vitals? And they don't quickly, and you get frustrated. Like, no, you gotta communicate that stuff because they can't always sense in your tone of voice, in the pace that you're walking around the unit, that your level of urgency changed. So make sure you're communicating that. All right, number 4, reflect when you don't understand. As a new nurse, there's going to be a lot of things people are going to say to you real fast that you're like, what did they just say? I have no idea what they're talking about. Reflective listening is a powerful tool. I know you talk about it in therapeutic communication in your mental health class, but I'm telling you, this is a really great communication technique, and you can do it very casually. People don't even realize you're doing it. So if someone says something to you, hey, can you go grab a Dobhoff tube and start enteral feedings at 30 an hour and increase Q6 by 30 if the residual is less than 50, and you're at 500, and you're like, what? So you can take what you think you understand and reflect. So what I hear you saying is blank. Is that correct? Or let me make sure I get you right. You'd like me to start tube feeding? Or you know what I mean? Like, reflect what you understand. Provide the person the opportunity to provide more education and clarification. Don't just say, yep, and try and go and figure it out. Like, you're going to be behind and maybe you're not going to get it right. Like, just in that moment, say, hey, wait, let me just make sure we're on the same page. What I hear you saying is blank. Is that correct? It's a very non-threatening thing. It enables that person communicating with you to correct or further clarify in a really non-judgmental way. So that's one of my favorite things to do. And one of my things, my soapboxes is, y'all, if you don't understand something, ask. ask, ask, ask. I would much rather you ask me 17 questions than go do something wrong or go do something incorrectly and compromise patient safety. Like, you got to make sure you're asking. I don't care if you feel like you're bugging somebody. Ask, all right? And my last thing is to stay away and disengage from gossip. So, like I said, nursing's a team. And if someone's not pulling their weight, or if someone is rude, or if someone is not awesome, people start talking about it. And I wish it wasn't so. I wish that wasn't the way it worked, but it is. And the way to deal with that / not deal with that is a few things. I got 3 techniques to dealing with gossip. Number 1 is to totally disengage when people start talking to you about somebody else. This can be a little awkward, but it's totally worth it. I've done it before. Had people start talking to me about somebody else, and I either don't say anything at all and kind of do something else, get on the computer and say, or don't even respond. So say nothing or absolutely very little, be very disengaged, not interested at all. And people soon figure out that it's not really fun to talk to you about other people, so they're just going to stop talking to you about other people. So I think that's a really helpful tip. I've used it before. It works. It is a little awkward at first, but it is effective. And when you are disengaged, when people are trying to gossip to you, but then you're really engaged and interactive and caring and funny, or you're really engaged when they talk about other things. It's like, oh, okay, like, it's not like I'm just someone who's going to ignore everybody. Like, I just don't want to talk about other people, right? So there's that. Next one is if you're in a group setting and people start ragging on somebody else or like gossiping, every time they say something negative, replace it with a positive thing. Like, man, I can't believe this new nurse didn't know how to do blank. And then it's like, well, hey, did you see yesterday how she responded to Dr. Smith when he was kind of rude to her? I was pretty impressed. Like, she's already going toe-to-toe with the doctors. And yeah, you can teach her blank, but that's really hard to teach. Like, I was pretty impressed when I saw her do that. And then soon it's not fun to talk about this person anymore. So then the subject just kind of naturally changes. And then boom, they're not gossiping anymore, or at least to you. And my final one, and my husband has done this before, and I think it's a great tactic. When people start talking negatively about somebody else, and especially in a group setting, he'll just kind of slip in there like, man, I wonder what people say about me when I'm not here. And it's like this little question, little like, and it kind of makes people think, and you say it in a little bit of a joking way, so it's not serious, but it is kind of serious. Or like, man, dang, I wonder what y'all say about me when I'm not here. Like, saying it in like a little bit of a joke, but not, and it kind of makes people kind of realize what they're doing. And I love that. Because this stuff is all usually really subtle. It's not like people sit down and say, hey, we're going to start talking about how terrible this person is. It's these subtle actions. And you're not going to have us sit down and say, no, you were having negative, things to say about this person. Can you tell me what you were thinking? Like, communication is a lot more subtle than that. And you'd think it'd be this big obvious thing, but it's not. So I think these really subtle techniques really do help disengage from that. So I hope these tips help with you as you start to communicate with your new coworkers. Let me just rattle these off again. Number 1, build rapport. Number 2, start off right. Number 3, give a heads up when things change. Number 4, reflect when you don't understand. And number 5, disengage with gossip. So stay tuned for our next mini video. And it will be when I chat about how to talk to the physicians, advanced practice providers, as well as the healthcare team members, therapy services, case management, social work, chaplains, things to expect for you as the leader of the healthcare team, the nurse, communicating with them as you provide patient care. So thank you guys so much for joining me. Have a great day.